Namaste. This is Dr. Vaishali Ashok Bhide, MD Homeopathy. Today, we will be talking about cervical spondylosis or the commonest neck pain that we see in practice. So, cervical spondylosis is the osteoarthritis of the joints in the neck. The word cervical means neck. So, this is a problem of the vertebra in the neck. So what exactly happens in cervical spondylosis? Let's see. The vertebrae are placed on top of each other, and in between them is a cushion which is a cartilage, that is a intervertebral disc, and in between these two vertebrae from either sides the nerves are going to be coming out. This is how the vertebral column is placed. So what happens is, as we age, the bony structure or the bony vertebra undergo some wear and tear, and they in them are produced small growths, offshoots, bony spurs, plus the intervertebral disc, which we call, is also going to get old and wear and tear, and this is the disc which is going to cause maximum of the symptoms. So what exactly happens is, as we know, the nerves are coming out. The bony growths can press or cause pressure symptoms around the nerves. The intervertebral disc, which is trying to come out, initially puts pressure on the first structure, which could be ligaments around, and then it starts pressing on the nerves. Then, as we progress, first set of symptoms will come, and as the disc keeps progressing, more and more symptoms will come. So let's see what are the symptoms of cervical spondylosis. The commonest symptom is neck pain, which is followed by stiffness. As we know, the more and more the disc progresses out, or the more and more the pressure symptom increases, the neck symptoms will come. So first we start with pain and stiffness. The next to come is pain along the arm, which side is affected, which is followed by tingling and numbness. So patients tell us mungi aata hai right till here, right till the tip of the finger. This usually happens on one side first, where the disc is pressing. However, if we allow this to progress, usually it is the second side also which gets involved. So what are the causes of cervical spondylosis? As we earlier mentioned, it is a age related process. So as we age, there is a degeneration happening in the vertebrae, and that is the anatomical reason why it happens. Secondly, the most important cause is putting strain on your neck, which means carrying heavy weights for prolonged time. Then it also could mean keeping your head or your neck in one position for a long time, and this is the increased incidence today with the computer jobs and sitting in odd positions, uncomfortable positions. We usually have neck pains which stays for a prolonged time because they're working for prolonged hours, and a continued use of the mobile phone, which is also responsible for being your head being in an odd position for a long time. So let's see how we diagnose this. Usually, when the patients come to us, the symptoms are very clear. Vertigo is one of the most disturbing symptoms which can come a little later, and this vertigo is the one which is aggravated more looking up. We have to differentiate any vertigo from ear troubles, so we usually ask any symptoms related to the ear. In case those symptoms are absent, then an X-ray of the neck is recommended. This X-ray, if positive, shows reduced disc spaces, which means there was a disc in between the vertebrae, and because of the wear and tear, the space is reduced. C5, C6, C7 is usually where it is seen. This is how it is diagnosed. However, many a times patients themselves know the diagnosis. They have come with their big files to us for treatment, and this is a very common phenomena. And unfortunately, with the use of mobiles and gadgets, we are getting young people now who are complaining of vertigo and neck pains. Vertigo is dizziness. So let's see the treatment of cervical spondylosis. So in treatment, as always, we will talk two things. One is the medicine that we will be giving. Second is the lifestyle modification. In this case, it will be your physiotherapy exercises. So with homeopathic treatment, we take a long case as usual with details on the physical stress that you're undergoing, the mental stress and the emotional stress that you are going through. Then we will also ask you symptoms which are pertaining to your problem. That is, when is the problem most aggravated? What helps you relieve the pain? And under what mental stress do you feel this pain maximum? After knowing your individualistic symptom, a remedy is selected. So basically what I'm coming to is, if you would keep 5 patients of the same diagnosis in front of me, the diagnosis of the neck pain cervical spondylosis, I would be giving different medicines to different people because their body structure and their stress is different. This is how homeopathic medicine is a very specialized and individualistic medicine. And once we prescribe the medicine, we also expect a certain way that the treatment should progress, that the recovery should progress. For example, as we said, first there was pain, then there was stiffness, then there was numbness, and giddiness comes somewhere in between. So the first initial symptoms are the ones which represent the maximum extent of the disease, which should get better. So first your giddiness and your numbness of the arm should go, and then the stiffness reduces, and then the pain reduces simultaneously. This is how it exactly progresses in the opposite direction, how the disease has progressed. So the treatment and the cure, or treatment and the disease, are opposite. Now there is one word of caution or a request which I would like to give to the younger generation, that because of the excess use of the mobile phones and the odd position in which we always look at them, there is a extra pressure on the vertebrae, and cervical spondylosis is, or the neck pains and the vertigo, is seen much earlier in the age group than we would want to expect. I am currently practicing in Dadar West, Shivaji Park area. I am practicing at Sapley's Polyclinic, Malik Building, D.V. Deshpande Mark, Shivaji Park, Road number 4. You can also follow me on Facebook, YouTube, Instagram, Twitter. Stay happy, stay blessed. I am soon coming up with my second book on homeopathic medicines, titled Unlocking the Boger Synoptic Key Part 2. This is a book specially for the homeopathic students and the doctors, as it gives them volumes of information at their hand or at their disposal, and they can use it in different cases, be it some difficult cases which seem very, very difficult in practice. Thank you.